I am Dr. Suzy Soliman. For those of you who don't know me, I am the founder of the Pharmacist Moms Group, and I'm also a pharmacist in New Jersey. I am also a pharmacist and still licensed in Illinois as well, where I'm originally from. So this conversation is in partnership with Florajen Probiotics, the refrigerated probiotic brand that I know many of you are familiar with as pharmacists. And you can stay tuned because we are going to have a Florajen giveaway during this conversation. And at the end of the conversation, I will have more details about the giveaway that you will have a chance to win probiotics for yourself and for your children. So now, as we dive into the topic of women's health, I am very, very excited to introduce Dr. Allison Hill, who is virtually here with me today. Allison, could you please introduce yourself to our viewers?
Sure. Hi, everybody. Great to be here. I'm Dr. Allison Hill. I'm the medical correspondent for Florajen, and I'm a practicing OB/GYN in Los Angeles. I've been in private practice for about 25 years. I'm originally also from Illinois, and I am also the chief of staff of my hospital, which is Good Samaritan Hospital in LA. And I previously was on a Discovery Health television show about delivering babies that was called Deliver Me, that ran for 4 seasons. So if any of you have kids in their early teen years, you might know that show back when you were pregnant. And we took care of a lot of pregnant moms and followed their journeys during pregnancy and their birth. And so that was really fun too.
No, that's great. Yeah, that's great. I'm sure many people watching today have seen you before. So you know, Dr. Hill, Pharmacist Moms is a community of pharmacists and moms, and many of us are going into work every day trying to help patients basically navigate this global pandemic. So everything's kind of changed. Our routines have changed, work has changed, everything has shifted. I'm sure yours has as well. Can you share how your experience has changed during the pandemic?
Yeah, I mean, it's been crazy out here in LA. Of course, you know, we have been hit relatively hard, not as hard as New York, but there was a lot of fears and unknowns, of course, about the virus. So a lot of our practices really shut down. We really stopped seeing any routine wellness exams. We just kind of focused only on our pregnant patients and on people with emergencies. And then kind of switched over to doing virtual visits as well, which was really interesting. That wasn't something we really did much in our field.
Yeah, I'm sure. Exactly. Yeah,
we never really thought about that as a thing we could do in gynecology. But it turns out there are some topics that I think really can be addressed in a virtual visit. And we often have the plan, you know, talk to us online, on Zoom or on Skype. And if your problem isn't solved after we have the talk, then you would probably need to come in for an exam. So at least we could get people through some early steps before they would come in for a visit.
Yeah, definitely. I think that's what's important, just to make sure that if they need to come in, then they might have to come in. Have you noticed any additional unexpected trends or changes maybe over the past few weeks?
You know, there's been a couple things. One thing that I've noticed is a lot of women have been missing their period, and which is kind of interesting. But, you know, we see this a lot in times of stress, that our bodies will stop ovulation because our body thinks it's not a good time to have a baby, which is what ovulation is for. And so if you don't ovulate, you don't get a period. And so I have a lot of patients coming in now saying, my last period was March 1st and I haven't had a period since.
Wow.
And so hopefully as things though normalize, you know, that will all return. But our bodies are great the way they protect ourselves.
Yeah, definitely. No, but I can imagine that being the case. And then I thought also, because I keep seeing those memes where there's going to be a baby boom in 10 months. So I didn't know if there was another reason to.
The other way. Yeah. We'll have to see.
Yeah, exactly. Yeah.
I mean, a lot of uncertain times. But, and then the other thing I think I would have noticed is just that people's habits have changed incredibly. I think people's eating habits, their exercise habits, people are spending a lot of time in their pajamas or working out more in their workout clothes. So there have been a few runs on UTIs and vaginal infections. And I think maybe people are home seeing their partners more and having more sexual activity as well. Yeah. So we're definitely seeing some changes in that too.
Interesting. Because I know the topic of, general health in general right now is very big, how to stay healthy, what we can do, how can we stay in our best shape, what are some tips and tricks. And this has been going on in conversations that we've had even within the Pharmacist Moms community. You know, what can we do for ourselves, what can we do for our patients? And a lot of times what's been recommended is to take a probiotic, you know, to improve immunity, to keep our bodies balanced. You know, and I think a lot of pharmacists often have questions as to which type of, you know, probiotic to take and why to take it and what does it do, and should they just consume it through food, or should they actually take a supplement, and whether it's to recommend to their patients or to themselves. Can you explain to us a little bit more about why probiotics are integral to women's health, especially during this time?
Yeah, I think, you know, is the one thing that is so interesting about our female parts, our genital tract, is that it really is this very delicate balance of bacteria and yeast, and, you know, everybody is supposed to live in that area in harmony. And when they don't, that's when all these infections kick in. So we are supposed to have in our vaginal canal a dominant organism called lactobacillus. And it is when lactobacillus gets low that our pH balance is thrown off. And when the lactobacillus also is low, these other organisms can overgrow very easily. And so this condition of having the lactobacillus depleted can lead to UTIs, yeast infections, bacterial vaginosis, and these things can be really stubborn to treat. And, you know, a lot of times you'll just go and, you know, try an over-the-counter antifungal, or you try an antibiotic, but until the lactobacillus grows back, the environment is such that the infection can just grow right back again. So sometimes people will be in these cycles of UTI and then a yeast infection and then BV, and they just keep spinning around in this circle. And the whole kind of underlying problem is the lack of lactobacillus. So that's what's great about all these, you know, the probiotics on the market. And for women's health, we really want to have women focus on finding a probiotic that contains lactobacillus, like Florajen. So you really want them to look for things that contain what they're missing, essentially.
Yeah,
And
no, I think that's a great point, because I think you're right. I've seen those cycles as a pharmacist where patients are coming back and they keep coming for, you know, then they might take an antibiotic in between and they're taking over the counter, and it's just the same cycle of going back and forth. You know, based on your experience with probiotics, so how do you make patients, you know, how do you make a good recommendation? Because there are so many probiotics out there. I was actually in a chat today with a few pharmacists, and they were just asking, you know, which probiotic and what's recommended. So there's so many options, and how do we know which one to go to?
I think first and foremost, for this particular problem, you're going to want to focus on something that contains lactobacillus. And then the other thing is that you want to try to be able to deliver as many colonies of the bacteria of the lactobacillus as possible. And so one of the things is that when the product is refrigerated, what that tells you is that the refrigeration is going to keep those colonies of bacteria high. Whereas if you're buying a probiotic that's just off the shelf, those colonies are dying out as it's sitting there on the shelf. So the more active colonies you can get, the better.
Right. Yeah, and it'll last longer, because, you know, it's not dying every day. So yeah, that makes sense. In terms of like for kids and everything else, do you recommend them taking the probiotics too? You know,
I think for kids, a lot of it, again, has to do with a lot of kids use it for digestion.
Yeah.
You know, and some kids just tend to have those upset stomachs, and, you know, different foods will set them off. And so sometimes adding the probiotic for kids, you know, is something, and I know Florajen has a product for them as well, that just helps them with the digestion.
Yeah, definitely. Yeah. My daughter is one of those kids. So she knows, like, she actually asks me for her probiotic every morning. Like, she is regimented with it.
It really makes them feel better. I mean, just things digest better. And so they don't develop as much bloating or gas production.
Yeah, definitely. I mean, I see it with her. She knows she needs it. So it makes a difference. Do you have any other tips or tricks on how to keep yourself or your family members or your patients healthy during the pandemic?
I think, you know, this always boils down to just the real basics in medicine, which is, you know, people always ask me, how do I keep my immune system strong? And I was, you know, you have to eat healthy, you have to get, you know, 7 or 8 hours of sleep, you know, and eliminating stress, or at least finding ways to work through the stress.
Yeah.
Because all of those things are going, you know, when you're stressed, your cortisol levels are high and your immune system doesn't function as well. So, you know, finding those ways personally that you can get to a peaceful place in the midst of all this uncertainty, I think is really important.
Yeah, definitely. No, I agree with that. I think the stress is always going to be there. So it's kind of just like how you manage it too.
Yeah. And some people seem to be more affected by it than others, you know, but if you find that you are, you really have to try to work through ways of getting that under control.
Yeah, no, definitely. So for everyone listening, if you're interested in learning more about Florajen or how you can help your patients learn more about probiotics, you can go to Florajen's website and check out their healthcare professionals portal. You can go to florajen.com/professional, and you can download a bunch of valuable resources and request patient coupons as well. I do want to wrap up and just go back to the giveaway. So if you've watched How You Can Win, we're going to give away 10 participants a 2-month supply for both Florajen Women and Florajen Kids. Leave a comment below in this video, and we will try to answer your question if or a comment or question. It's linked to the video, and also visit the Florajen HCP portal as well. And then they will be selecting 10 participants to win, you know, a 2-month supply, which is great.
Yeah, that's great.
Yeah, but thank you so much for doing this. It was great to have all of your
thanks.
your
It was nice to be able to reach out to you guys. And I know in pharmacy, you guys didn't have, you weren't staying home. You were probably working more than you ever have. So
Yeah.
I know it's a scary time for everybody.
Yeah, no, thank you. Yeah, it's been crazy for a lot of pharmacists. But yeah, thank you. And we'll talk soon, I guess. Take care. All right, thanks.
All right. Thank you so much.